Let us now go to diagnosis through the tongue. The topic is coating part 2. In addition to inspecting the color of the tongue coating for diseases, the thickness, dryness, and presence of coating should also be taken into consideration. The changes in the thickness of tongue coating is indicative of the status of evil qi and vital qi in the body, as well as the severity of the disease. Thick layer of coating. Thickness is measured in comparison with your normal coating. When you cannot see the color of the tongue texture through the coating, it means the condition has become more severe or there is gastric retention. Observing the thickness of tongue coating is conducive to determining the prosperity or decline of vital qi or evil qi and the severity of the condition. Thick yellow dry coating indicates depletion of yin due to excessive heat. Thick and greasy white coating indicates cold dampness obstructions of the spleen and stomach. Thick powder-like white coating indicates retention of cold phlegm. Coating growing thick indicates the condition becomes more severe. Coating growing thin indicates the condition is improving. The tongue coating that is dry and lacks fluid is called dry coating. In severe cases, dry cracks may appear in the coating. Inflammation or chronic disease tend to have excessive heat accumulated in the body, leading to the depletion of fluid. The tongue cannot be nourished by fluid and turns dry as a result. Dry coating with a white tinge indicates poor water and fluid circulation in the body. Dry coating that is yellow in color indicates hyperactivity of stomach fire. Dry coating that is black in color indicates fluid depletion due to extreme heat. And a dry coating that is black in color with prickles indicates extreme heat exuberance, drying up body fluid. Putrid coating. This refers to a thick coating with big, rough, loose bumps, which is thick at the center and both sides of the tongue, like bean curd residues piling up on the tongue surface that are easy to scrape off. This mostly indicates a heat syndrome manifested as excess of endogenous heat. Dull and putrid coating with white or yellow color is often seen in food retention, turbid phlegm, and a dampness heat syndrome. Abscess-like coating, that is abscess putrid coating, indicates deterioration of an internal abscess. Membrane of white coating or erosion, that is moldy, putrid coating, is often seen in patients experiencing damp worm toxin, diarrhea, and infantile malnutrition. Greasy coating. This refers to tiny particles closely distributed and evenly forming into patches, attached closely to the tongue surface. It is thick at the center and thin on the sides and not easily scraped off. This sign indicates stagnation of dampness and turbidity, manifested as phlegm dampness and food retention. White, smooth, greasy coating indicates mostly phlegm dampness or deficiency of stomach yang. Thick and greasy yellow coating indicates phlegm heat, damp heat, and retention of food. Thick, greasy coating, not smooth, white as if thickly powdered, indicates external evil invasion accompanied by dampness. White, greasy coating, not dry, and self-reported sensation of oppression in chest indicates severe dampness due to deficiency of the spleen. White, thick, slimy coating and sweet taste in the mouth indicates damp heat of the spleen and stomach. Tips for caring for your tongue. For pale tongue, this is mostly the result of deficiency of qi and yang. To improve the tongue color, focus on restoring the deficiency and dispelling cold, invigorating qi to generate blood. Expose your back more often to the sun for its warmth. People with yang deficiency usually experience cold stagnation, so basking in the sun may help them replenish yang. It is recommended that people with a deficiency of qi in blood and a deficiency of yang should drink black tea, which warms the stomach, stimulates the spirit, warms yang, and invigorates qi. Massaging the Baihui point for 3 to 5 minutes every day will invigorate the yang in the governor vessel, thus toning qi and restoring the yang throughout the body. Gently scraping the skin on the back with gua sha therapy can also stimulate the yang of the back to replenish the yang throughout the body. For black tongue coating, with black tongue coating, therapies should focus on the aspects of diet, regulating work, a good rest schedule, and a TCM treatment to strengthen the body's resistance. In addition, avoid foods with heat properties such as spicy, pungent, and fried foods. Frequently consume vitamin-rich foods such as fruits and vegetables. Also drink water with ginseng slices and red dates, or Chinese dates, or jujube fruits. As ginseng can replenish the original qi, while red dates can promote blood circulation and tone the blood. If the black coating is thick and greasy, frequently massage the naguan point to help relieve blood stasis and smooth the flow of qi and blood. Exercise more with adequate amounts of time and intensity. It is best to just warm up until you perspire slightly. For thick white coating, when the coating is thick and white, it indicates cold dampness stagnation in the spleen and stomach. Therapeutic treatment focuses on warming the middle burner and toning the spleen. Frequently consume foods such as Chinese yams, mushrooms, chestnuts, and red dates, which tone the spleen, strengthen the stomach, nourish the blood, and tranquilize the mind. Eat less raw and cold foods such as ice cream and ice popsicles to prevent the cold from attacking the stomach. Do moxibustion at the guanyan point for 10 to 15 minutes every day to replenish yang and relieve symptoms of cold deficiencies in the spleen and stomach. Brush your teeth every day after you get up in the morning and before going to bed at night. Use salty water or mouthwash to rinse your mouth after each meal to keep your mouth clean. Thank you so much for your attention.